COVID-19. Alright, so I'm going to go over a little bit of my credentials just so, you can make up your own mind whether or not I might be educated about the topic. First of all, I've researched and synthesized documents acceptable for Public Health Accreditation Board, that's otherwise known as FAB, and that was creating protocols for generation of non-existent documents that are required for the accreditation process and I did that by organizing county shared drives. I have a 4-year degree in public health. I have completed training with FEMA. I've completed an AmeriCorps program. I've worked at the local, so like the county, the state, and the federal level in public health. A little bit more information. I've researched iPlan, that's the Illinois Project for Local Assessment of Needs, and some of the information I compiled was used by administrators for all different kinds of conventions, rural public health seminars, that sort of thing. I'll try to make a lot of information really quick. I've updated emergency operations plans, continuity of operations plans, and policies as they pertain to disaster mitigation. I've done that for field employees as well. The FEMA certificates that you'll see, that's Center for Domestic Preparedness, and that's in conjunction with FEMA. That's the Federal Emergency Management Agency. So we did training for mass casualty incidents. Not only that, but hands-on training for chemical, biological, radiological, nuclear, and explosive incidents as well. So during that training, we actually learned how to physically set up decontamination bays, how to operate radiological sensing equipment, how to don and doff hazmat suits up to the PPE level in B. So A would be the highest, that's like the fully encapsulated. So we learned how to use PAPRs, SCBA, I'll talk about that in a little bit. So what this means is that we physically went into a facility called the Cobra facility. It was contaminated with various live, that was ricin actually, and VX nerve agent, and various simulated, and that would be the radiological, nuclear, and explosive hazards. So gosh, I could just go on forever, but some of the other things I've done is I worked with a county to create a special needs registry. Essentially what that was is it created a flag in the 911 dispatcher database for this particular area, and it would allow first responders to know whether or not certain medical equipments might be needed when rescuing certain people from disasters. Some of the other things I've done is created information with a communicable disease department to host seminars to teach first responders how to cope with mental illnesses post-disaster recovery. I actually worked with the Centers for Medicare and Medicaid, implementing part of the Affordable Care Act. That's the healthcare.gov things. That wasn't a regulator, but we helped roll out some IT solutions and were able to get people to the seminars, that sort of things. We also answered questions about federally qualified health centers. During my federal work, I received a security clearance due to having access to HIPAA-regulated data. Not only that, but I sat in on the entire HRSA fiscal year 2015 operations planning and revision process, and that gave me a ton of insight into budgetary restrictions, planning, evaluation of public health programs, and how the effectiveness of those public health programs are analyzed. So, moving on, blah, 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 blah. I'm not trying to, beat myself off here. I'm just trying to say, I know at least some stuff. Maybe you agree or disagree. That's fine. I'm not worried about it. Anyways, so this is my silver lining slide. This is going to be in the beginning rather than the end. So a lot of what I'm going to say, I think, is positive at first. So the first thing you should think about is you have an immune system that's going to help detect and destroy viruses, bacteria, fungi, etc. And, there are things that you can do to bolster that immune system, and that's make it better. You can exercise moderately. That's, 30-minute walks outside, that sort of thing, which is great because the outdoors is completely ventilated. So, Anyways, you can eat healthy food. Basically, the funny thing is the way to distinguish whether or not food is healthy is basically what's still left on the grocery stores. People basically got all the unhealthy stuff, so, consider that. You can manage your stress. You can meditate. You can do yoga. You can do that by, sleeping more. And regulating your sleep, of course, will help bolster that immune system as well. Anyways, here are some things to avoid. All supplements and vitamins are not regulated by the FDA, so just stay the heck away from those. They're not useful. It's a waste of your money. Anyways, keep in mind that in the United States, we have the largest amount of food production and fresh water in the entire world. In fact, those are two of our largest exports. Keep in mind that domestically, paper products are made here. We don't import them from anywhere else because we have the means to produce it here. So I know people are freaking out that toilet paper and paper towels and feminine hygiene products and various other things are out of stock. That's going to come back into stock. So don't freak out too much. In fact, I would advise you not to stock up on that because a lot of grocery stores and things like that are saying if you try to return that stuff later, they're not going to take it. So just keep that in mind. Anyways, keep this in mind too. The news media has been decaying over the last forever, basically. It's becoming less relevant. It's kind of led to news sites utilizing serious-sounding, enticing sound bites and clickbait due to their monetization streams having changed in a very rapid period of time with the advent of the internet. So consider people that work in journalism, of course, have graduated with a degree in writing. They're not scientists, and they typically present data from abstracts, scientific abstracts, which are detailed papers typically published in medical journals and other various journal-type formats. And they tend to say stupid things like, red wine is good for you, and yeah, it can reduce some free radicals, but let's be real. Alcohol is empty calories. It's still bad for you. It causes neurological issues. So, don't take the news media too seriously. Obviously, they're capitalizing on this. And the reason that they're specifically doing that is obvious. They get the more clicks, the more revenue. But yeah, don't be a hoarder. That's led to a severe amount of supplies not being available where they're needed in medical facilities. So you stocking up on masks and such is actually not only a waste of your money, because you probably aren't putting them on correctly anyway. Like the other day when I went to the grocery store, I saw at least, 10 granny blue hairs with masks on, and they weren't even fully adhered to the sides of their face. So I don't know if you know how physics works, but when you're breathing, air is going to take the path of least resistance. So you're going to be breathing out of the sides of the mask anyway. So yeah, let's just use maybe some common sense here. Anyways, this is stupid, but I'm going to talk about what is public health, because I'm sure you've heard that a lot, and you probably don't really know what it means. But it is pretty much self-defined, so it's a broad terminology. It speaks to research and containing outbreaks with non-medical interventions, typically. This could be hygiene. Think your gloves, your masks, your hand sanitizer. This could be epidemiology. That's the study of outbreaks and utilizing knowledge to minimize their spread and quarantining things. I'm sure you've heard all those words recently. And a bigger part of that is prevention, which is just simply acting in a manner that can reduce continued contamination. Both medical and non-medical staff practice these sorts of behaviors, obviously. Anyways, moving on. So what the hell is coronavirus? What is COVID-19? Look at this horrible picture. Look at this red crap, on the outside of some, circular ball. I mean, every picture I've seen of it has pretty much been red. I mean, that's obviously used because it's an alarming color, not because it's actually red. So, keep that in mind. Anyways, this is a viral strain. It has many similar symptoms to a cold or a flu. Many of the symptoms shouldn't be alarming, and many of them you're not going to need to seek medical attention for. So if you think you have a cold and you go run off to your emergency room, basically what you're going to do is overwhelm the healthcare infrastructure, and you're going to kill the people who are actually at risk of dying from this illness. So also consider hospitals are the dirtiest places in the frickin' world. back in the 1900s, usually like when you got sent to a hospital, you were being sent there to die. So just consider that, like this is a dirty place, even when it's soaked in hand sanitizer, which currently, sorry guys, isn't available. But yeah, there's a reason why there's a lot of terminology describing nosomial infections. That's a hospital-acquired infection. That's why people tend to die from sepsis at a hospital. That's why people, especially in these circumstances with, masks being all bought up by the general public and sanitizer and that sort of thing, it's going to make your trip to the hospital more dangerous. So if you just have a cold, you might get something worse just from simply visiting a hospital waiting room. So yeah, keep that in mind before you head out over there. I would probably use your local doctor first, so they can calm you down prior to you making the potentially expensive trip to the emergency room. Anyways, here's the dangerous symptoms to look out for with regard to coronavirus. These are going to be trouble breathing, persistent pain or pressure, confusion, like you are all of a sudden a confused person when you weren't before, and if you have bluish lips or face. Keep in mind that's not an all-inclusive list, so any other severe symptoms that you might have that would warrant a trip to the emergency room are valid reasons to go to an emergency room. Anyways, I can't stress this enough. Emergency rooms are for emergencies. If you don't have an emergent condition, one that is, by its very definition, likely to kill you, then you're going to be sitting around in a hospital waiting area for probably several hours because they're going to triage you, which is a rapid system of deciding who they should treat first. Anyways, let's move on. What is a virus? So most people probably don't even know what the hell a virus is to begin with. It's a diverse, highly mutatable DNA hijacking machine which replicates itself at the expense of a host in order to perpetuate itself. So there's a cute little picture there that shows how it works. There's a little picture of basically what a virus looks like and its various parts. Not terribly important for this particular discussion, but if you're interested more in that, I suggest you research it. Anyways, some common illnesses that are a result of viruses are obviously influenza, that could be chickenpox, that could be HIV, that could be the common cold, that could be rabies, blah, blah, blah. Anyways. Health conditions that could put you at risk, there are some on the right-hand side of the screen there. So anybody who has, AIDS, that would be the post-HIV part of, that thing. So, you'd have to be diagnosed with it. Don't just assume you might have it because you're gay or because you're HIV and you're taking medications that make you undetectable. You have to be diagnosed with AIDS specifically. Anyways, cancer, whether you had it in the past or whether you have it now, diabetes, malnutrition, immunosuppressive drugs for any reason, most commonly for organ transplants, asthma, severe forms of it, and COPD, cardiovascular conditions, etc. Those are going to be things that exacerbate the symptoms of this virus, which could make you more at risk. So just that's something to keep in mind. If you have those things, you know that. And if that's what's true and you start to get some of those, more severe symptoms, you should definitely seek help immediately. Anyways, moving on. There are occupations that are more at risk. Typically these are going to be your medical staff. Obviously, the reason for that is because they're interacting with sick people. Yeah. Anyways, I would say the bigger thing to worry about is that low-paid retail and food working roles, all of which have a high degree of interaction with people and foods and things you put on your body, like lotions, that sort of thing. Those people tend to have little to no paid time off. They're typically not full-time workers. They typically don't have benefits in some circumstances. So if that's their reality and they're preparing your food, that's something to consider when deciding whether or not to eat out. Yeah. I'm going to say most businesses obviously are going to do their due diligence to, under this hyper freaked out state that we're in, to send those types of workers home without pay for the day if they're sick. But, I've pretty much meal prepped most of my food for the last several years, so One thing I found with just making your own damn food is that you care about your health probably at that point. If you make your own food, you're probably less likely to just get sick overall, and in this particular situation as well. Anyways, how can you catch coronavirus? These are airborne droplets. They're expelled from sneezing and coughing. They can supposedly stay alive and disseminated, or active rather, in the air up to 4 hours. These could be fomite-borne things. That could be surfaces. That could be the idiots going around on YouTube licking produce in the grocery section. That, and depending on how porous those surfaces are, they could potentially stay active on that surface up to 3 days. I would say that that's probably not true, but some of the more alarming things I've seen out there have put it at the 4 hours for airborne and the up to 3 days for the surfaces. So I would just say if you're buying produce that's in open air, probably like wash that just as well as you're gonna wash your hands. Don't be crazy. Don't put hand sanitizer on your apple. Like that's pretty wacky. But anyways, moving on. What are some things that you can do to protect yourself? All right, so you can practice social distancing. That means you might be staying at home instead of going to work if you're lucky enough to have that as an option to work from home. If that's not the situation for you, you can still practice social distancing in public. You can stay up to 6 feet away from people. You can, avoid anybody who looks like they're coughing or sneezing, clearly. And honestly, if I worked in retail currently, I would probably try to see if I could get my boss to give us some masks. Because if somebody is exhibiting those symptoms, a mask is actually good for that person because it's going to absorb that nasty stream of that sneeze that you saw in, one of the preceding pictures. But anyways, some other things that you can do are you can keep away from groups higher than 10 persons. This is obviously not something everyone can do. Just practice it if you can. You can disinfect your contaminated surfaces. So if, you know who you live with, if they're exhibiting symptoms of a cold, if they're sneezing all over your freaking cooktop, like obviously, try to clean that up if you can. I know I already said this before, but eat healthy. Like most of the food remaining in the grocery stores right now is a better alternative than the stuff that people took. So, wash your veggies and fruits and eat them. Plus they have fiber in them, which makes you feel more full, so you tend to eat less of it. So it prevents you from eating too many empty calories as it is. So anyways, this is actually an air filter that I own. I have asthma, so, that sucks. So I'm one of the people who should obviously be concerned about this crap, at least to some extent, not to the extent the media is overblowing this, but there are particulate level air filters. I've noticed that since I started using these, I have a little bit less symptoms with my asthma and allergies. So I would say that might be a good practice for anybody who has any kind of disorder of breathing. That could be like vocal cord disorder, asthma, COPD, etc. Also, wash your hands. I'm not gonna go too much into that. There's so many videos now and so many crazy memes. Just kind of take it seriously. Soap destroys the lipid layer on a virus, rendering it ineffective. So yeah, just wash your damn hands. Let us continue. How does the testing work? It's actually really awful. This is a picture of what they're going to do to you. They're going to take a ridiculously long swab and they're going to basically push that through your nose all the way to the back of your sinuses. It hurts. I've had this particular test, not for coronavirus, of course, but I've had a test done that was very similar to this due to polyps in my nasal cavity. And yeah, you don't want that in your head. It doesn't feel good. I'm just gonna let you know that right here. But let's see. So with regard to the testing, keep in mind everything I've seen shows that there's a lack of infrastructure for properly testing this. When I say that, really what I mean is there's an ability to test it, but the amount of testing kits remains limited and they haven't been dispersed evenly across large populations. So what this means is that only persons thought to probably be a large risk to others are likely to be tested. So if you are practicing social distancing and you're a white girl named Rebecca and you're 27 and you have no freaking underlying health conditions, they're probably just going to tell you to go home and sleep it off. Like, sorry, Rebecca, but you're freaking out too much. Anyways, I kind of mentioned triaging earlier, but that's basically an assignment of degrees of urgency to wounds and illnesses to decide the order of treatment of a large number of patients or casualties. You can read up about what's happening in Italy. You know, persons over the age of 80 and persons with multiple comorbidities that have either not much of a quality of life left or quantity of life left are being triaged out of being tested for this or treated for it because, I mean, sadly, the healthcare system there is overwhelmed, and that's something that could happen here if people continue their stupid hoarding habits. Anyways, what I have seen too is there is a ton of misinformation out there. There are fraudulent test kits out there. You obviously don't own a lab, so you can't test you for this. A lot of people, even when tested, they have no symptoms, so they could disperse this and not show any symptoms at all. So just be realistic. Like, you're not needing to go to an emergency room for this unless you have those severe symptoms like I was saying earlier. Anyways, wash your freaking hands. I already said this. If you cough or sneeze into your hands, wash them. If you're caring for someone who's sick, wash your hands first. Wash your hands before and after you eat your food. Do that after your toilet use. Do it if your hands look dirty. Do it if you are handling animal waste or animals. Like, it's just common sense, I think, but apparently not. Anyways, should you wear a mask? The answer is no. Do not buy masks. Do not wear them. They are not for you. They are for healthcare providers. If you're providing care to individuals with respiratory symptoms, if you are a health worker and attending to individuals with respiratory symptoms, if you yourself have respiratory symptoms, also, yes, wear a mask because you're limiting, again, like I said before, the amount of droplets you're injecting into the air. If you are the general public and you're on a trip to the grocery store and you're hoarding masks, all I have to say to you is you're an asshole. Yeah, that's it. That's the end of that. There's no argument you can make that properly shows that you should be wearing a mask. And look at this mother clucker. Like, this mask is not even put on correctly. It doesn't fully cover his freaking nose and mouth. Like, you can see that there are gaps. That mask should be lined up across the face. So when this person is breathing, they're breathing through the sides of that mask and through the front of it. So just keep that in mind, you know? You probably don't know how to wear a mask properly anyway because you're not a freaking healthcare worker, most likely. Anyways, if you are a healthcare worker or you are one of the people who should be wearing a mask, here's how to properly wear it. Before you put the dang thing on, wash your hands. Wow. Oh my gosh. How many times am I going to have to say that? You're obviously going to want to cover your mouth and nose, and there should be no gaps between your face and the mask. Like I said earlier, I've seen people at the grocery store, they're freaking wearing masks, and there's like gigantic gaps. I'm like, come on, man, you guys are silly. Don't touch the mask while you use it. If you absolutely need to, wash your hands first. You're going to have to replace the mask with a new one as soon as it's damp, and you do not reuse single masks. Obviously. You also need to know how to properly dispose of a mask. You want to remove it from behind. You do not want to touch the front of the mask because it's obviously contaminated. You want to discard it into a closed bin due to the fact that this is an airborne virus that can last in the air up to 4 hours. And then after you take the mask off, even if you think you didn't touch the front of it, wash your hands again. Jesus Christ, just wash your hands. Anyways, I'm going to talk a little bit about vaccine development cycles and vaccines just in general. So this guy has actually been showing up on the news a lot. His name's Dr. Anthony Fauci. He's the longtime director of the National Institute of Allergy and Infectious Diseases. That would be NIAID. Here's what he says. He's the foremost authority on this in the entire world, pretty much. He says a vaccine that you would make and start testing for in a year is a vaccine that is not deployable. The earliest it would be deployable is in a year to a year and a half, no matter how fast you go. So don't be lining up to be a guinea pig to take any potential vaccines. Think about it this way. Every year there's a new flu vaccine, right? Like, there's a reason for that. It's because viruses mutate quickly. So, maybe they'll have an annual rollout of this type of vaccine as well, but don't take it until it's been tested, obviously. I mean, come on. Use your freaking common sense. Anyways, here's another like thing. I've just heard friends and like people freaking out. They're like, "Oh my God, everyone's dying in Italy!" Like they're just making such a crazy deal out of it. So some things to keep in mind about Italy, and this is not me trying to be racist. This is just pure facts. Italy has an aging population. They have a higher life expectancy there than we do here. So there are a lot of people in their above 70s and 80s age. So, like I already mentioned before, persons in that particular category who are not expected to have much quality of life and who might have a comorbidity of symptoms are not likely to be triaged in a manner that gets them any treatment in their overwhelmed healthcare system. Anyways, another thing that's important is that Italy has close ties with China. They have a rail system from Italy to China, and there are multiple mandates from a communist regime that go along with that rail system. Like Chinese rail police are on that train. So there's a higher level of tourism between China and Italy. I'm not saying that's a bad thing. I mean, that's probably great for their economy. But in the event of obviously having that outbreak having started there and the rail system not getting shut down until, pretty far into the system, that is why there is a lot of issues in Italy. So don't be a racist jerk. Don't be Donald Trump. Yeah, whatever. Anyways, so our politics to blame. This is just my sense of humor, but realistically, I mean, Trump dissolved the global pandemic office that delayed response to this. Trump claimed that he made Pence in charge of the task force, but he isn't. In fact, it's actually Secretary Azar from DHHS. He's the chairperson. So, I mean, Trump's been spewing out lies and confusing things and not been taking it seriously. And I think that's honestly led to people acting in a much more panicked response than they needed to. So keep in mind that due to Trump's blatant racism, he has actually upset people in China to the degree that some of their officials have hinted at withholding pharmaceutical trade in the United States. Think about it this way. They had a giant quarantine. Many of their people were unable to work. So, what happened to the output of those factories? Probably it decreased. So think about this. China imports 90% of our pharmaceuticals. And in the event that China actually did this, it could technically be considered an act of war due to that being biological warfare, due to the fact that obviously pharmaceuticals are a medical necessity for many people. Anywho, that's not to freak you out. It's just, things to maybe pay attention to in the world. So what is the impact of hoarding? Many people have been hoarding supplies such as sanitizer, paper towels, toilet paper, rubbing alcohol, masks, feminine hygiene products, etc. This has led to shortages not only in the consumer world, but in medical facilities. Think about a medical facility not being able to sterilize a hospital. Like I said earlier, those are pretty much the dirtiest places in the world. That's going to exacerbate the number of deaths, whether or not someone has coronavirus. Think about this as well. Many truckers are being overworked right now. That could lead to accidents. That could lead to theft of shipments. That's basically how supply and demand works. When you want something and you can't get it, you might be more desperate to do bad things in order to get it. Keep this in mind as well. A lot of grocery chains, I know I already mentioned this, but they are issuing advisories that if you load up on all this crap and then you try to return it later, you're not going to be eligible to return it, probably due to the fact that, it's in your house, it could potentially be contaminated, etc. So, what are the economic impacts? I think that there are going to be some pros and some cons. Some of the pros might be policy changes that could potentially be universal healthcare someday. That could be universal income. That could be non-enforcement of evictions and utility shutoffs. That could expand the U.S.'s attitude on working at home. That could potentially lead to cancellation of student debt and other forms of debt. And there is multiple stimulus packages in the works currently. I'm not going to describe them all. There's 3 of them, I think, that have been rolled out with more to potentially come. Some of the cons, obviously, are that in prior recessions, we've seen industries consolidate. We've seen antitrust laws go unenforced. So what that means is industries will monopolize or oligarchalize. I don't know if that's a great way to make that word sound, but And when companies do that, that leads to a lack of innovation and it leads to higher costs in the supply chain for basically everything, which is why, you know, everything's gotten more expensive even as wages have stayed stagnant. That's why, you know, probably in like the 70s and 80s, for instance, you could buy a truck for $7,000 and a house for like 40 grand. And today that same thing is going to cost you about 250 to 500,000 for that same house, or 70,000 for that same truck. It's kind of crazy. The short-term effects are going to be felt hard by pretty much everyone, but especially the most vulnerable, those who can't go to work because their kids are now staying home, that sort of thing. There's already been an explosion of unemployment claims and business closures, and this is obviously most certainly going to lead to a recession. So that's not only for the reasons of the coronavirus itself and the trade issues, it also has to do with the fact that this is an election year. It's probably going to be a polarizing election year due to this being at the tail end of Trump's presidency. And, you know, those are just some things to kind of think about for the future of how you want to see the country move. Anyways, in conclusion, is this going to be the end of the world? No. But yeah, stop hoarding. Seriously.